4 medication that may boost dementia risk in older adults. Have you ever wondered whether that everyday medication sitting in your medicine cabinet could be quietly compromising your brain health? Millions of seniors are taking common pills right now that doctors increasingly believe may accelerate cognitive decline and increase dementia risk. What makes this especially concerning is that many of these medications seem perfectly harmless. They're not exotic experimental drugs, but familiar prescriptions and over-the-counter remedies that have been trusted for years. If you're approaching retirement age or caring for someone who is, this information could be crucial for protecting memory and independence. Today, we're diving deep into 4 medication categories that neurologists are increasingly linking to cognitive problems, examining not just the science behind the risks, but also practical strategies for safer alternatives. This isn't about creating unnecessary alarm. It's about empowering you with knowledge that could make the difference between a sharp, vibrant mind in your golden years and the gradual fog of cognitive decline. 1. Anticholinergic drugs, the hidden brain drainer. When we talk about medications that secretly sabotage brain function, anticholinergics deserve front row attention. And here's why you need to understand what they are and how they work. These drugs function by blocking acetylcholine, one of your brain's most essential neurotransmitters responsible for memory formation, attention, and learning. Think of acetylcholine as your brain's personal assistant, constantly organizing information, maintaining focus, and helping you form new memories. When medications interfere with this crucial messenger, the results can be devastating for cognitive function, particularly in older adults whose brains are already more vulnerable to chemical changes. What makes anticholinergics particularly treacherous is their widespread presence in both prescription medications and over-the-counter products that seniors use regularly. We're talking about antihistamines for allergies, medications for overactive bladder, drugs for depression and anxiety, muscle relaxants, and even some blood pressure medications. Many seniors end up taking multiple anticholinergic drugs simultaneously, without realizing the cumulative effect on their brain function. This combination approach creates what researchers call a cholinergic load, essentially overloading your brain system and dramatically increasing the risk of cognitive impairment. Dr. Sarah Chen, a geriatric neurologist at Johns Hopkins, has spent years studying anticholinergic effects in older adults. Her research shows that people taking multiple anticholinergic medications have a significantly higher risk of developing dementia compared to those who avoid these drugs. What's particularly alarming is that the cognitive effects can appear subtle at first, maybe a bit more difficulty concentrating during conversations, or forgetting where you placed your keys more frequently than usual. These changes often get dismissed as normal aging, but they're actually warning signs that your brain chemistry is being disrupted. Consider Margaret, a 72-year-old retired teacher from Minnesota who was taking 5 different medications, each containing anticholinergic properties. Her doctor had prescribed a medication for her overactive bladder, an antihistamine for seasonal allergies, a muscle relaxant for her back pain, and antidepressants for her mood. What seemed like appropriate treatment for multiple health issues was actually creating a perfect storm for cognitive decline. When Margaret's daughter noticed her mother's increasing confusion and forgetfulness, they scheduled a medication review with a pharmacist who specializes in geriatric care. The pharmacist identified that 3 of Margaret's medications had strong anticholinergic effects and helped her doctor find safer alternatives. Within 6 months of stopping the anticholinergic drugs, Margaret's mental clarity significantly improved, and her family noticed she was much more alert and engaged. The insidious nature of anticholinergic cognitive damage lies in how slowly it develops. Unlike some medication side effects that appear immediately, cognitive decline from these drugs can take months or even years to become noticeable. By the time symptoms become apparent, significant brain changes may have already occurred. This gradual progression makes it crucial for seniors and their caregivers to be proactive about medication reviews rather than waiting for obvious problems to emerge. 2. Sleep medications, the sedative brain trap. The relationship between sleep problems and aging is complex, and unfortunately, the medications many seniors turn to for relief may be creating more problems than they solve. Benzodiazepines, commonly prescribed sleep aids, and sedative medications work by depressing central nervous system activity, essentially putting your brain into a slower, more subdued state. While this can help you fall asleep initially, the long-term consequences for brain health can be severe and far-reaching. Benzodiazepines affect GABA receptors in the brain, the same system that alcohol impacts, which explains why these medications can create dependence and cognitive fog. In younger adults, the brain typically recovers quickly from occasional sedative use, but aging brains lose this resilience. The blood-brain barrier becomes more permeable, brain metabolism slows, and the liver's ability to clear medications decreases, meaning these drugs stay in an older person's system much longer than intended. Instead of helping for 6-8 hours, the sedative effects can persist for 24-48 hours, leaving seniors in a constant state of mental dullness. Robert, an 81-year-old former engineer from Arizona, represents thousands of seniors caught in this medication trap. After experiencing insomnia following his wife's death, his doctor prescribed a commonly used benzodiazepine sleep aid. Initially, Robert felt grateful for the relief from sleepless nights. However, over the course of 2 years, his family watched him transform from an alert, detail-oriented man to someone who struggled to follow simple conversations and frequently lost track of time. His daughter, a nurse, recognized these as classic signs of medication-induced cognitive impairment and encouraged her father to discuss alternatives with his physician. What makes sedative medications particularly problematic for seniors is their impact on the brain's natural sleep architecture. Deep, restorative sleep requires natural cycles of activity and quiet periods in different brain regions. When artificial sedatives force the brain into an unnatural state, these natural cycles become disrupted, leading to poorer quality sleep despite longer duration. The brain misses out on crucial maintenance activities that occur during natural sleep, clearing out waste products, consolidating memories, and repairing neural connections. Over time, this disrupted sleep pattern contributes to cognitive decline and increases the risk of developing dementia. The solution isn't simply stopping sleep medications abruptly, which can be dangerous and cause rebound insomnia and anxiety. Instead, it requires a comprehensive approach to sleep health that addresses underlying causes of insomnia rather than just masking symptoms with sedatives. Cognitive behavioral therapy for insomnia, CBTI, has been shown to be more effective than medications for long-term sleep improvement, and it carries no risk of cognitive side effects. Simple lifestyle modifications like maintaining consistent sleep schedules, reducing caffeine intake after noon, creating comfortable sleeping environments, and limiting screen time before bed can also significantly improve sleep quality without medication. 3. Older antidepressants, the memory-sapping mood PILLS. Depression in older adults presents unique challenges that require careful consideration when selecting treatment approaches. While antidepressant medications can be life-saving for many people struggling with mood disorders, not all antidepressants carry the same risk profile when it comes to cognitive function. Tricyclic antidepressants, which were among the first generation of depression medications, present particular concerns for senior brain health that many people aren't aware of. Tricyclic antidepressants work by increasing levels of serotonin and norepinephrine in the brain, while also blocking acetylcholine receptors. The anticholinergic effect we discussed earlier comes into play here again, but with the added complexity of multiple neurotransmitter system disruption. For younger adults with robust brain chemistry, these effects might cause manageable side effects. However, for older adults whose neurotransmitter systems are already naturally declining with age, these medications can accelerate cognitive deterioration significantly. The story of Helen, a 68-year-old retired librarian from Oregon, illustrates this problem perfectly. Following the loss of her sister, Helen experienced severe depression that affected her ability to enjoy daily activities and maintain relationships with friends and family. Her primary care physician prescribed a tricyclic antidepressant, which seemed to help with her mood symptoms initially. However, over the next several years, Helen's family noticed concerning changes in her cognitive abilities. She became increasingly forgetful, struggled with word-finding difficulties during conversations, and had trouble managing her finances tasks that had been effortless for her throughout her career and early retirement. When Helen's daughter, a physical therapist who worked frequently with elderly patients, began researching the side effects of her mother's medication, she discovered the cognitive risks associated with tricyclic antidepressants. She arranged for Helen to see a geriatric psychiatrist who specialized in older adult mental health. The psychiatrist explained how Helen's medication was likely contributing to her cognitive decline and worked with her to switch to a newer antidepressant with fewer anticholinergic effects. The transition required careful monitoring and gradual dose adjustments, but within 6 months, Helen's family noticed significant improvement in her memory and mental clarity. What makes older antidepressants particularly concerning is their widespread use in senior care, often because they're familiar to physicians and typically less expensive than newer alternatives. Insurance coverage frequently favors these older medications, creating financial pressure on both doctors and patients to use them despite cognitive risks. Additionally, many older adults have been taking these medications for years before the cognitive risks became well understood, creating situations where long-term use may have already contributed to preventable cognitive decline. The key to safe antidepressant treatment in older adults lies in collaborative decision-making between patients, families, and healthcare providers. This includes thoroughly discussing cognitive risks, exploring alternative treatments like therapy, lifestyle interventions, and newer antidepressants with better safety profiles. For seniors already taking older antidepressants, regular cognitive monitoring and periodic medication reviews can help identify problems before significant decline occurs. 4. Over-the-counter PM medications, the sneaky cognitive culprits. Perhaps nowhere is the hidden danger of cognitive decline more insidious than in the over-the-counter medications that seem completely harmless because you can buy them without a prescription. PM pain relievers, sleep aids, and allergy medications line pharmacy shelves with labels promising better rest and pain relief, but many contain powerful sedating ingredients that can quietly undermine brain function in older adults. Diphenhydramine, the active ingredient in many PM pain relievers and sleep aids, is a first-generation antihistamine that was originally developed to treat allergies. Its sedating properties made it popular for nighttime pain relief and sleep assistance. But what many people don't realize is that diphenhydramine has strong anticholinergic effects that can last for days in older adults. When combined with the natural age-related decline in brain chemistry, this ingredient can create significant cognitive impairment that's often mistaken for normal aging. Frank, a 76-year-old retired mechanic from Michigan, represents thousands of seniors who regularly use these seemingly innocent medications. Frank had been taking PM pain relievers every night for his arthritis pain, assuming they were much safer than prescription medications because he could purchase them at any drugstore. Over the course of 3 years, his family watched him become increasingly confused and forgetful. He began having difficulty with tasks he'd performed for decades, like balancing his checkbook and following recipes he knew by heart. His wife became concerned when he got lost driving to his regular grocery store, a route he'd taken hundreds of times over many years. What made Frank's situation particularly challenging was that no single healthcare provider was monitoring the cumulative effects of his over-the-counter medication use. His primary care doctor wasn't aware of how regularly he was using PM pain relievers, and Frank himself didn't think to mention it because he didn't consider just some over-the-counter medicine worth discussing. When his family finally brought him to a geriatrician for a comprehensive medication review, the doctor identified diphenhydramine as a major contributor to Frank's cognitive problems. Like many seniors, Frank had been taking 50-100 mg of diphenhydramine daily for years, essentially maintaining a constant state of mild cognitive impairment that accumulated over time. The widespread availability and marketing of these medications make them particularly dangerous for senior populations. Advertising campaigns often feature seniors looking comfortable and happy while taking these products, creating an impression of safety and appropriateness for older adults. However, what works safely for a 30-year-old can have devastating cognitive consequences for a 70-year-old due to differences in metabolism, brain chemistry, and overall sensitivity to medication effects. The solution requires education and awareness, rather than blanket avoidance of all over-the-counter medications. Reading labels carefully becomes crucial, as many products contain hidden sedative ingredients even when marketed for specific conditions like pain relief or allergy symptoms. Learning to recognize antihistamines like diphenhydramine, doxylamine, and other sedating compounds empowers seniors and caregivers to make informed choices. When sleep problems or pain issues arise, working with healthcare providers to identify underlying causes and develop comprehensive treatment strategies that don't rely on sedating medications can provide better long-term outcomes for both comfort and cognitive health. Remember, protecting your brain health doesn't mean suffering unnecessarily from pain or sleep problems. It means working with healthcare providers to find solutions that address these issues effectively without compromising cognitive function. Physical therapy, exercise programs, relaxation techniques, and non-sedating pain management strategies can often provide better relief than medication while protecting the brain from additional stress and chemical disruption.